Hi everyone, welcome back to my YouTube channel, and today we are going to talk about endodontics. So let's start our topic with introduction. Endodontics is a specialized branch of dentistry that is focused on diagnosis, prevention and treatment of diseases affecting the dental pulp and tissue surrounding the root of the tooth. The term endodontics comes from Greek word endo meaning inside and odont meaning tooth. Endodontic treatment, commonly known as root canal therapy, aims to save teeth that might otherwise need extraction due to infection, inflammation, or trauma. Modern endodontics combines advanced techniques, materials, and technology to preserve natural teeth and maintain oral health. Definition of endodontics. Endodontics is defined as a branch of dentistry concerned with the study, diagnosis, prevention, and treatment of disease of dental pulp and periapical tissue. It also includes procedures to repair or restore teeth that have undergone pulp damage due to decay, trauma, or other causes. Objectives of endodontics. First is preservation of natural teeth, as in this, teeth are saved that are affected by pulp disease or injury. Second objective is relief of pain, as it alleviates toothache caused by pulp inflammation or infection. Third objective is restoration of function, as it restores proper chewing and occlusion. Fourth function is prevention of infection, as it stops the spread of infection to surrounding tissues or systemic areas. Fifth objective is aesthetic consideration, as it maintains natural appearance of the tooth. Anatomy relevant to endodontics include dental pulp, that is soft tissue inside tooth containing nerves, blood vessels, and connective tissue. There are root canals, that are tubular structure within the root where pulp resides. Third is apical foramen, that is opening at the tip of root through which nerves and blood vessels enter. Fourth is periapical tissue, that are tissues surrounding the apex including periodontal ligament and bone. Understanding the complex anatomy is essential for effective treatment. Common indications of endodontics. First is dental caries, as deep decay reaching the pulp cause irreversible pulpitis. Second is dental trauma, as fractures, luxation, or avulsion lead to pulp necrosis. Third is infection, as abscess formation due to bacterial invasion of pulp tissue. Fourth is cracked or fractured tooth, that is pulp exposure or inflammation from structural damage. Fifth is tooth discoloration, as sometimes it results from pulp necrosis or previous trauma. Diagnosis in endodontics. Accurate diagnosis is crucial to determine the need for treatment. It is done in three steps: clinical examination, radiographic examination, and pulp testing. Clinical examination includes signs that may be swelling, tenderness, mobility, and sinus tract. Symptoms may be spontaneous pain, sensitivity to hot or cold, and throbbing pain. Then there are radiographic examination, in which X-ray reveals periapical lesions, root canal anatomy, and entry of decay or trauma. Third is pulp testing, that includes three types of tests: thermal test, electric pulp test, and percussion test. Thermal test is hot and cold substances applied to check pulse vitality. Electric pulp test assess nerve response, and percussion test identify inflammation in periapical tissue. Endodontic treatment procedures include five steps. First is excess opening, that is removal of decay and opening the pulp chamber for treatment. Second endodontic treatment procedure step is pulp removal, that may be pulpotomy or pulpectomy. Pulpotomy is removal of coronal pulp in children or selected cases. Pulpectomy is complete removal of pulp from root canals. Third is cleaning and shaping of canal, that includes removal of infected tissue, debris and bacteria, and also shaping canal to receive filling material. Fourth is disinfection, that is irrigation with antimicrobial solution like sodium hypochlorite or chlorhexidine to eliminate bacteria. Fifth step is root canal filling or obturation, that is filling the canal with material such as gutta percha to prevent reinfection. Sixth is restoration, that is placement of a crown or filling to restore tooth structure and function. Endodontic material. They include root canal filling material, irrigants, and temporary restoratives. Root canal filling materials include gutta percha and sealants. Gutta percha is thermoplastic material that is commonly used, and sealants are used alongside with gutta percha for tight sealing. Then there are irrigants that may include sodium hypochlorite, EDTA, chlorhexidine to disinfect canals. Then there are temporary restoration, that are materials to seal excess cavity between the appointments. Advances in endodontics. There are rotary endodontics, that is the use of mechanical rotary files for faster and more precise canal shaping. Then there are apiclicators, that are electronic devices to determine the exact length of the root canal. Then there are microscope assisted endodontics that improve visibility for complex canal and anatomical variations. Then there are laser assisted endodontics that enhance disinfection and reduce bacterial load. Then there is bioceramic sealers, that are advanced sealing material that improve long-term success. Complications in endodontics include instrument breakage in canal, overfilling or underfilling of canal, post-treatment infection or pain, tooth fracture after treatment, persistent symptom due to missed canals. Preventions in endodontics include early detection and treatment of caries, protective restoration for weakened teeth, use of dental sealants in children, and proper oral hygiene to prevent mouth disease. Conclusion of this lecture video. Endodontics is essential for maintaining natural teeth, relieving pain, and preventing infection. With modern techniques, materials, and technology, endodontic treatment has become more predictable, efficient, and comfortable for patients. The ultimate goal is to preserve teeth, restore function, and improve oral health, allowing patients to retain their natural smile and quality of life. And this was all about endodontics. Hopefully, you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.